Thank you for staying with us at 4:30. Lawmakers at the state capitol have come up with one measure to address the heroin epidemic.
Yeah, a bill that would limit the amount of opioids doctors could prescribe received unanimous approval in the House, and it's now headed to the Senate.
Fox 61's Erin Logan, she joins us now with reaction from medical experts. Erin.
Lorenzo, Jen, both a doctor and a pharmacist I spoke with agree this is another step in saving lives. Under this proposed legislation, the prescriber can only give a 7-day supply of an opioid drug for first-time outpatient use. Of course, there are exceptions, but one question that came up, will this encourage people already addicted to pain medication to turn to heroin?
These medications are associated with overdose deaths, and that's real and it's frightening.
From oxycodone, morphine to methadone, Dr. J. Craig Allen works with patients daily who are addicted. He's applauding the House of Representatives' support of a bill that would limit the patient to a 7-day supply of an opioid drug by their prescriber. This would be for first-time outpatient use. Dr. C. Michael White also agrees there are a lot of positive aspects to this proposal.
What the legislature's trying to do is they're trying to say, if you're just going to be on it now, let's do something to try to limit the number of pills that you're going to be exposed to.
Both White and Allen cited studies verified by the Centers for Disease Control that say there are no additional benefits of taking pain relievers after the 3rd or 4th day.
But the longer that you're exposed to those drugs, the greater the risk is that you could develop a tolerance or you could develop an addiction.
And the greater the risk of family and friends having access to any extra pills lying around in a 30-day supply. Dr. White says one aspect that could be problematic, this 7-day supply rule could be costly and an inconvenience for some who legitimately need more.
How is the physician going to feel about writing for an extra 7-day supply without seeing you again? And then if he wants to see you, what do you do for time off from work in order to be able to schedule that, and the copay that you'd have to pay at the physician's office in order to be able to get that additional 7-day supply. In the legislation, they're supposed to be trying to make some exceptions.
For example, those who've had extreme surgeries or are taking opioids for end-of-life care. One concern Dr. White has, will less access to opioids encourage those already addicted to look for other options?
Heroin is a readily available, inexpensive way for you to be able to continue that fix. So I think there is going to be more people who are going to start using heroin.
Hopefully the sort of the opposite will happen, in that prescribers will identify people who are at risk or who have developed addictions.
Again, this proposed legislation was passed unanimously in the House. The Senate has not yet voted. Coming up on the Fox 61 News at 5, we'll hear from a heroin addict in recovery about his thoughts on this. Live in the studio, Erin Logan, Fox 61 News.